While uncommon, testicular cancer is the most common cancer among young men aged 15 to 44. Fortunately, testicular cancer is very curable, with a 95% 5-year survival across all stages. Ultimately, awareness and early detection are paramount to optimizing outcomes in patients with testicular cancer. This necessitates the use of monthly self-examinations among all young men to detect for any irregularities, lumps, bumps, or pain in the testicles. If any of these symptoms appear, it's important to seek prompt medical attention. There have been some risk factors also identified for the development of testicular cancer. These include most commonly cryptorchidism, or an undescended testicle, a family history of having had testicular cancer, a personal history of testicular cancer, or an entity called germ cell neoplasia in situ. There are several types of testicular cancers. The overwhelming majority are termed germ cell tumors. Now, there are two major types of germ cell tumors. They include seminoma and non-seminoma. Among non-seminomas, there are also several subtypes as well. It's important to distinguish seminoma from non-seminoma, as this will ultimately guide treatment. When a testicular mass is suspected, the first test to perform is called a scrotal ultrasound. This is because an ultrasound has high sensitivity and specificity for diagnosing testicular cancer. In addition, there's a special set of lab work called serum tumor markers that needs to be obtained. When the suspicion is high, it's important to seek care from a urologic surgeon, as the first step is to undergo a radical orchiectomy, or removal of the testicle. This is the gold standard operation for the diagnosis, prognostication, and, in cases of early stage disease, even potentially cure for testicular cancer. Radical orchiectomies are a relatively minor same-day procedure that take up to an hour or less and involve a relatively quick recovery period. After a confirmation of a germ cell tumor diagnosis, additional labs and staging imaging of the chest, abdomen, and pelvis are typically performed. There are 3 overall clinical stages for testicular cancer. Stage 1 testicular cancer involves cancer just limited to the testicle alone. Stage 2 involves lymph nodes in the abdomen, or what is referred to as the retroperitoneum. Stage 3 involves distant metastases, which can involve other sites in the body. When approaching the treatment for testicular cancer, it's important to first differentiate pure seminoma versus non-seminoma and the clinical stage. The goals of treatment are to maximize oncologic control, minimize overtreatment and toxicity, preserve long-term quality of life, and to minimize costs. The options for testicular cancer management are rather nuanced and can range anywhere from surveillance alone for early-stage disease, chemotherapy, radiation therapy, or a surgery referred to as a retroperitoneal lymph node dissection. It's important to engage a multidisciplinary team anytime a new diagnosis of testicular cancer is made in order to come up with the appropriate treatment plan. As testicular cancer predominantly affects the younger populations, there are indeed some unique long-term survivorship concerns inherent to this disease. The first is infertility. As many patients are in a stage of their lives where they are contemplating family planning, we offer sperm banking to all patients affected by testicular cancer. Next is hypogonadism, or lower levels of testosterone amounting from decreased production from losing a testicle. Furthermore, body image is absolutely an important concern. As many patients are also in a stage of their lives where they are engaging with relationships, body image plays a crucial role, and we offer testicular prostheses for all patients who are undergoing a radical orchiectomy. Furthermore, as testicular cancer affects younger patients, there is the need for lifelong surveillance over the course of decades. This entails significant cost, radiation exposure, and the need for compliance with these surveillance regimens. Mental health concerns are also indeed an important survivorship aspect to testicular cancer care. Finally, with the use of certain therapies, long-term cardiovascular toxicities and secondary malignancies may also amount to long-term concerns. At Johns Hopkins, we have what's called the Testicular Cancer Go Team, which is a multidisciplinary group of specialists who collaborate to ensure that new patients get timely access to care and individualized treatment plans. Furthermore, we also recognize the importance of fertility and hormonal concerns in treatment planning. We will guide you through your options with an eye towards family planning. To learn more about the Testicular Cancer Program at Johns Hopkins, please feel free to contact the Brady Urological Institute, and it would be our pleasure to take care of you in a timely manner.